war's over, everybody knows the good guys lost. Everybody knows the fight was fixed. The poor stay poor, the rich get rich. That's how it goes. Everybody knows.
And welcome to the Grassroots Connection, where we provide the information you need to make an informed decision. And today we have a special guest in with us, and I'm sure you're familiar with Rich Bolen. He's been in before, chairman of Lexington County Republican Party. And today we're going to discuss health care and health reform. Let's see here. Get your mic up. How you doing, Rich?
I'm doing great. Can you hear me all right?
Not hearing you very good at all, but let's try it again.
All right. Now can you hear me?
Yeah.
I can hear me through.
Gotcha.
Okay.
Those headphones make you look a little silly, man.
Yeah, I feel like a pilot.
Sorry about that, but, that's the only way we can hear each other in here. Before we get into it, though, Rich, I want to go ahead and give out our call numbers. We're at WOIC.com. That's WOIC.com. You enter that into your search engine or browser, and our homepage pops up. And once that pops up, you scroll on down and you see the Grassroots Connection, funny-looking black guy with a hat on. You tap on that, and that brings you into the stream, brings you into the chat room. And once in the chat room, you have to be a Stickum member, and then you can go ahead and list any URLs or any other information you'd like to in the chat room, even garage sale stuff. We're pretty liberal around here with that sort of thing. As long as it's not vulgar or obscene, you won't get booted out, But you can call us today at 742-1230, 742-1230, and toll free at 888-671-7278. All right. Well, let's go ahead and get into it there, Rich. And you wanted to talk about health insurance reform today. That seems like a pretty controversial topic.
That's right.
We're going to dive in. I hear the water's pretty cold, but we're going to try it anyway. What do you think?
Well, I think it affects everybody, whether we like it or not. So we have to deal with it, even though we may not want to. The law, the way it's written, means everybody has to deal with it one way or another.
Absolutely. So, well, what do you think of the health insurance reform I guess that's right, health insurance reform. Right. That the administration proposed and they passed.
That's right. They passed it back in March.
Yes.
I think it's a terrible mistake. It's a monstrosity that we will spend, if it ever gets implemented, we will spend the next 40 years wishing we had never done it.
Really?
And then trying to undo it. So hopefully we can undo it before it ever takes effect.
Good. Okay, well, I'm going to try to play objective and devil's advocate here, okay? All right. So what are some of the points that you feel make the legislation a failure?
It basically creates a monopoly. They sold it to us as just another alternative to our health insurance.
Mm-hmm.
But the fact of the matter is the penalties and things that go into the bill are going to cause all employers to just drop health care and let you go to the government plan. I'm an employer. I've got 3 employees of my own, and it's definitely cheaper for me to not pay for their health insurance, let them go get this new Obamacare,
right,
which I'm paying for anyway with
right,
my taxes, and just forget about health insurance. And the insurance companies are going to take the same attitude. They're going to say, there's no way we can make any money doing this. There's so many rules and regulations that don't make sense in the marketplace that we can't adjust, that are one size fits all, and we can't make a profit, so we're just going to get out.
Well, it was my understanding that some of those same insurance companies have raised their rates already in anticipation of this legislation taking effect.
Right. I've heard that too, and that's the free market trying to make it in spite of the government, not because of the government. They're making it harder for them. They're trying to come up with ways to survive and make enough money to stay afloat, and I'm not sure they're going to be able to do it. And certainly after the bill implements slowly, it goes in a chunk at a time. Mm-hmm. It's going to be harder and harder for those insurance companies to make a living because they can't do what the market requires them to do.
Right. Now, I think I understand your point on why you think it will fail or it is a failure. Are there any things inside the legislation that you feel are good?
not that I have not read the whole bill. I've only read synopsises, but I don't believe anyone's read the whole bill. But everything I've heard about it is just big government and surely doomed to fail.
Yeah.
I don't know anything that the government does better than the private sector. Literally, there's almost nothing, and I'd be happy to hear some examples from your listeners, but literally there's nothing the government does better than private sector. They do some things because they're the only ones that will do it.
Okay.
Private sector's not going to do certain things, but if they were tasked to do it, they would figure out a way to do it better than the government.
All right. Well, I think what I heard from Rich there was a challenge to the listening audience to call in at 888-671-7278 with any points that you feel are positive in the health insurance reform as we know it today, okay? So if you have any you want to challenge Rich on this point, call in. We'll get right to you on the phone lines and let you right in here. We don't have a call screener other than me, and I'm not much of a call screener. I'm going to let you on the mic. So come on in. The water's fine. 888-671-7278. Now, Rich, that I've done that and made sure that they can get in, I don't know. Have you been kind of paying attention to the news lately? International? Yeah, I know you have, man. Let's see. What I'm getting at, or what I want to bring up, is this situation with Guatemala and the human experimentation that was done by the U.S. government. And looks like now we have, the news has traveled all over the world. We have several judges in different countries saying that this is a crime against humanity. And it's certainly sad, but it's not the first time that we've seen this sort of thing in America. We know that, the Tuskegee experiments went on for years, and it just seems that once we give the government a certain amount of power, they tend to abuse it. Now, a lot of people say, well, you've got two examples there. What are you really talking about, Andre? Well, in 1845 through 1849, J. Marion Sims, later held as the father of gynecology, performs medical experiments on enslaved African women without anesthesia. I won't get into the really gross details, and I want to touch on several of these, so time's gonna require me to surmise. Then we have another example in 1895. New York pediatrician Henry Hyman infects 4-year-old boy whom he calls an idiot with chronic epilepsy with gonorrhea as part of a medical experiment. And a side note to this, human experimentation before the Nazi era and after. That's a book where you can find this information. 1896, Dr. Arthur Wentworth turns 29 children at Boston's Children's Hospital into human guinea pigs when he performed spinal taps on them just to see if it was harmful. Harvard professor Dr. Richard Strong infects prisoners in the Philippines with cholera to study the disease. 13 of them die. He compensates survivors with cigars and cigarettes. Real nice guy there. Dr. Hideo Noguchi, I hope I got that right, of Rockefeller Institute for Medical Research, publishes data on injecting an inactive syphilis preparation into the skin of 146 hospital patients and normal children in an attempt to develop a skin test for syphilis. Okay, and that's also in that same book, Human Experimentation in America Before the Second World War. In 1913, medical experimenters test 15 children at the Children's Hospital St. Vincent's House in Philadelphia with tuberculosis, resulting in permanent blindness in some of the children. 1915, Dr. Joseph Goldberger, under order of the U.S. Public Health Office, produces pellagra, a debilitating disease that affects the central nervous system in 12 Mississippi inmates to try to find a cure for the disease. One test subject later says that he had been through 1,000 hells, quote unquote. And in 1935, after millions die from the disease, the director of the U.S. Public Health Office would finally admit that officials had known that it was caused by a niacin deficiency for some time, but did nothing about it because it was mostly affecting poor African Americans. And just a side note, I think I've got a few more minutes. During the Nuremberg trials, Nazi doctors used this study to justify their medical experiments on concentration camp inmates. And that's this Dr. Joseph Goldberger. So, and these are just some of the early ones. We still have things going on right now, and a lot of people would bring up fluoridation, mass fluoridation in the water supply, and also these aerosol spraying in our atmosphere. I know this is kind of a little far afield, but it is certainly pertinent to the discussion in that you have to have faith in your health system before you just turn everything over to the government. I don't have any faith in them, especially with these vaccinations. We've got a lot of information saying that these vaccinations that they've been pushing for the last couple of years really offer no protection against the influenza and are commercially we're being perpetrated upon by people who would like our money out of our pockets, and they don't have any problem with scaring us with influenza. So that's why I brought this stuff up. I know you're probably on a whole nother track here, but I think that those issues have to be brought up and legitimately talked about.
I can time in, I'm sure.
Oh yeah. Well, we've got about a minute and 30 seconds, and so I'd say in a minute we'll go into a break or get ready for it. And I see the phone lines haven't jumped up, and I see, let's see, in the chat room, isn't the insurance company like BCBS, UHC, and so on making big money currently and denying coverage to their clients? Yeah, I think that's for you, Rich.
Right. That's a common myth. If you look at industry overall, people that build cars or skateboards or provide food service or other services, health insurance in particular is one of the lowest profit margins in all of the United States. Their profit margin is very small compared to the volume of the money that they bring in. Somebody like Bill Gates, he builds software, and he spends, let's say he spends $1 million to develop a program, and then he sells 100 million copies of that disk at even $1 a piece. Mm-hmm. He's making a fortune off of that.
Oh, yeah.
And a health provider, they deal with every case by case, and they're paying all this money, and they can only charge enough under the rules. And the rules are very tight already without this new health bill. So they don't have much room to make money. So it's a common myth that they were making a fortune. They're doing all right, but they're not going to be around for long under this new bill.
Okay. All right. Well, I wanted to get into another point, but looks like we're headed off into a break. So let's go ahead and get ready for that. Our call-in number, 742-1230, gets you in. And toll-free for our out-of-state listeners, 888-671-7278. And as always, live and streaming at WOIC.com. And we'll be right back with more Grassroots Connection right after this break as we kind of explore health insurance reform and what it means to you. We'll be right back.